Alright, Dr. We're live.
Hey guys, it's Dr. Emer, and we're here now doing our CO2 laser. We're about finished with the Deep FX. This is our deeper laser. He has a lot of that irregular cobblestoning type of scarring, which requires much deeper resurfacing. Yes, he may get a little more sort of downtime or a risk of hyperpigmentation, a duskiness that he'll see a few weeks later. But the end result at 2 or 3 months is going to be significantly more by doing the deep laser. And you guys can see with the deep laser, the little dots are much smaller, but a lot deeper. And this is going to allow remodeling of very deep scars.
There's some Vegas people on here saying hi to you.
Hey guys, so good to see you. So look here we are. We're going over the temple area as well, being very cognizant of the areas that I have topographically mapped.
Yes, we're going to start luminous. Yes, this is our luminous ultra pulse.
Tried and true. Love this device.
Runs all day long.
Exactly.
Can you use this on Asian or brown skin?
Of course, you guys. I did it this week many times.
Guys, watch our YouTube. Watch our Instagram.
And this is going to be followed by the active. We're going to do that in a second. I just want you guys to see at least what the deep can do. Okay, so you guys can I'm going to take a quick look. Make sure everything's really even. It looks perfect. Okay, so now we're going to switch the device. So I'm going to show you guys using on this side. I'll grab it. Give it to me. And then what I'm going to do.
Where in Los Angeles are you located exactly? 9201 West Sunset Boulevard in West Hollywood. Unit 510.
Exactly. That's exactly it.
That's exactly.
So now we're going to numb a little bit more because we do nerve blocks, but it's not 100%. So it's very important. This will help get the numbing into the area as well a little bit deeper because we did all the lasers, which created the channels in those areas. We're going to wipe off this area first, the forehead, so we can treat that area first. Lay your head straight for me. Perfect. And so we're just making sure everything's really numb in this area, and then we're going to continue with our acne scar combo. I'm really excited, you guys, because CO2, when you do this right, can give a really nice improvement in scars. All right, you ready? All right. Rose is going to get that area ready to go. And we just get everything really numb here. Perfect. All right. So now we're going to do what I call quadrant treatment. Getting the laser set.
As if you guys want to see on the screen that we won't show you.
Can't do it. What?
I'm the boss.
We have Rosa, who's going to New York with us.
All right. And you guys can see. I'm going to turn your head just a little this way. I'm going to test here. Perfect. So you guys can see the laser working. Look at the holes in the wood. Okay? That's what it does on the skin. We're going to start in the temple. You'll feel a little bit here. Okay, it's not going to be fully numbed. So
any chance of pH after CO2?
Much chance, yes. So we pre-treat the best we can from emeragecosmetics.com with Enlightener Cosmelon peels. Typically Cosmelon, it's a very specific CO2 laser protocol. And then after treatment, we have post-care, specifically with peptides, stem cells, hyaluronic acid, and barrier repair creams, as well as enzyme cleansers. Will you grab the back there? I want to push this.
Go, Rosa.
Oh, Bianca. Hey, girl. Just move the cord so I can push
How
back.
much do you guys charge? It depends on the combination and what
Right,
we're doing.
perfect. There we
you
go.
guys
Stay
need to
just
send
like
us
that.
a DM,
Don't move, okay?
full name, email, phone number so we can reach out to you.
Be careful. So now we are working on the full resurfacing. And you guys, this is the CPG handpiece, or what we call scanning. And in the old days, we didn't have fractional scanning. So you could see here, all the little dots are going in a very specific pattern, delivering energy evenly throughout. In the old days, it all depended on the distance. What were you saying?
What's good for large pores? I need a strong session for my pores.
Halo, guys. Come in for Halo or Moxie. A little bit of microneedling, radio frequency, and some Aerify. Tell them how to make an appointment.
You guys send us a DM, full name, email, phone number for any of those questions. We'd love to have you here.
Okay, and you guys can see he's doing extremely well despite there being some pain. And this is a very high density. Go ahead.
Can you combine ECA and CO2 in the same session? We do that all the time, guys.
That's in every video I do, guys. Almost every video.
Watch our YouTube, watch our reels, you'll see it there.
If you're asking that question and you're a provider, please don't do the treatment. You need to get training. No offense. I don't mean that in a bad way.
We offer training as well.
Yes.
Send us a DM for that.
Yes. So you guys see we're following a very specific pattern. This also is going to help us find lines and wrinkles. Younger guys in middle age are going to get a nice anti-aging from this treatment. Some people, the redness can persist for many months. Some people, it goes away in just a week. Dermabeam is a very specific thing you would use on your skin to get rid of the redness. We have it at emeragecosmetics.com. And my Aerify kit has in it niacinamide, arbutin, and licorice root, as well as kojic acid to help that, hyaluronic acid. So it's very important you guys do good skincare. I know.
What's good to apply right after this?
Well, we apply immediately my Emer skin mask. Do we have one of those? Make sure that they do. We're going to apply my Emer skin mask. Very important. Those have in it vitamin C, licorice root, hyaluronic acid, and peptides to help him heal, as well as tea tree extract to make sure that he doesn't get an infection.
How much time has to pass before each session?
2 months. Perfect. Show that Emer mask.
Fractional
Rosa,
or fully ablative?
this is fractional. Rosa, show them the Emer mask. This is
our
on our
new
new
Emer
mask. It's on emeragecosmetics.com. We did a lot of clinical testing with this mask. Hyaluronic acid, licorice root, vitamin C, 2 brightening botanicals, peppermint, and tea tree. And it really helps heal. Okay, it's going to make him calm his skin much faster, decrease the redness, and help him heal much quicker. Okay, turn to the right a little bit more. Good, you're doing great. So we'll apply that at the end, and we'll brush on some of that serum with the PRP.
Do you recommend spotting tretinoin prior to Morpheus?
Oh yes, consult us.
And if so, how many days before you might be the right?
Stopping? No. Consult us. You guys can see you got a very meticulous, got to be required.
Why not do just one fully ablative instead of several fractions?
Because he's very deep, and if that's the old school mentality, and he would not get a lot of improvement in his scars because he doesn't have wrinkles. He has scars. Wrinkles, that would do that. But in this, because he's got scars, they're much deeper. You need to do fractional depth. All right, let's wipe off his cheek. Forehead is complete. That will not give him the result he is looking for, unfortunately. So hopefully you're not a provider. No offense. Again.
We do have
All right,
training
we're wiping you
providers.
off.
We do have opportunities for providers to shadow us, to come see what we do. We have one here in the room with us.
Oh yes, our good friend is here.
We have our good friend, Dr. Yoel.
Turn to the right a little bit.
He's a
There you
plastic
go.
surgeon, but he's watching us do face right now.
He's learning the magic. So you guys see here, I've marked topographically certain markings. So I'm going to start up in the temple here and focus on some of these deeper scars again. And you just have to be very meticulous. You got to take your time.
How many treatments will he need?
He's gonna need multiple treatments. This is gonna be the one bigger, sort of ablative treatment. I think this one he could do again in 6 months to a year if needed. I would like him to do things like Fraxel or Halo long term with Pixel, maybe a little more filler to really build on the improvement we're gonna get here. Let's see how much he gets. That's the key. Let's do the first treatment and see. But you guys have to be okay with having multiple treatments. This takes time.
Would a fully
And
ablative
consistency.
laser be would a fully ablative laser be better on shallow scars and
Sorry.
pores rather than
Sorry.
deep ones?
Yes.
You guys see we have other CO2 we use.
You
We
okay?
go almost fully ablative.
All right.
We have our contour TRL.
You're doing really good. I'm
This
doing
is
my
definitely
best.
ablative
The
for
lateral
an
part of the
acne.
face is hard to fully numb. So it's going to be less as I'm in the middle here. Let's
We
be a little
train
more.
Derm MDs.
Yeah.
We have nurse practitioners. We do train them. We offer training guys. Send us a DM if you're interested in training. We'd love to help you. Lots of providers today.
What?
Lots of providers today.
They're
BBL
home
plus CO2 in the same session. Can we do that?
all the time. All the time.
We have our BBL sitting right over there.
And we do BBL with Halo. We do it with CO2, fractional, everything. So it's really the combination approach that's going to get in the best result. Initially doing this stronger laser, which he's doing really well. I know it's painful. This part's more painful, this lateral part of the face. But he's got only 1 minute on this side left. So we can do it. We can get through it. Keep breathing, okay? You can do it.
Which brand laser are we using? This is our Luminous Ultra Pulse.
Okay, I'll give you a second. Hold on. Take a breather. Take a breather. Got to finish. This part right here is very hard to numb, okay? We did topical. Here we go. Couple more. You can get through it. Just get through it. Another 30 seconds. I know. Blend. Okay. Deep breathing. Deep breathing. Here we go. Here we go. Couple
We have
more.
Rosa here with the shoulder rubs. Yeah.
All right. Take a break. Hold on. Take a break. We have 2 more rows, okay? There we go. Two. Thank you. Okay, take a break. Guys are definitely more sensitive, regardless of how much numbing. All right, 3 more.
A little bit less.
Breathe. 3 more. Here we go. 1. All right, good. That side's done. Let's go to the
I was trying.
Breathe. You did good. You did good. Let's go to the middle. So some people are more sensitive. This is good learning, you guys. Some people are more sensitive despite what you do. I'm going to try and get the lateral part done first on this side. We just took the numbing off. Okay, so I'm going to work over here. He's still going to feel it more, but I want to get through it. Deep breathing, deep breathing. Let me get through this part, okay? Over do your break. Hold on. Okay, take a break. Stay to the left. Stay to the left. And again, in this area, like the forehead, for example, he doesn't feel at all. Some people here, okay, here we go, are just more. Hold on, 1 more row. Okay, take a breather. Take a breather. There we go. Maybe a little less as you move closer. He's doing really good. It's tough, I know it's tough. All right, so as we move closer now, we got through the hardest part. He's doing better. Okay, very good. And you guys, if you notice, we have our innovative optic goggles on. Show them those goggles because
There you go, guys.
these were designed by
Check them
me
out.
and Innovative Optics.
You do TCA cross on Accutane.
Yes, of course. These are really good. We're over halfway done on this side now. So the TCA cross on Accutane requires a very specific aftercare. So make sure to contact us at MirageCosmetics.com.
With just about any laser treatment you have out there, we can send you skincare anywhere in the world. Even if you're not doing your laser with us, let us know what you're doing, and we'll have our specialist get you the right skincare regimen for your treatment.
Yeah, and tell them how they make that consult.
Guys, make that consult at emeragecosmetics.com.
Play flat.
Or if you have any hard time doing that, send us a DM, full name, email, phone number, we'll send you the link.
Exactly. So contact us, we'll send you the links. Working a little tighter here, a little higher density. I don't know any laser to be fun. So this is the least fun, especially for guys, but he's very good. We're about 2 more minutes remaining and that's it, we're done.
Will he peel? Yes, guys, he will definitely be peeling. Do you offer Pronox to patients?
We do, I just don't find it does that much. It makes people very nauseous sometimes. And we have nerve blocks. He's just more sensitive and we're almost done, so we're getting him through it. We'll have the cold air for him in a second. We'll have Emer skin mask, which I'll show you guys to help him peel.
Do you offer Silpherm X? It's similar to Pixel 8.
Yes, we do.
We have just about every microneedling radio frequency system you can think of.
Turn to the right. There we go. We're talking today about scars and the CO2 resurfacing.
Does this laser vaporize?
Yes, of course. All CO2 is vaporized. Almost done. Fully done. We're in the middle lip, little lip, on the middle lip. There you go. Good.
Do you need to prepare before going for a CO2 laser treatment? Yes, you do. We highly recommend that you do. We have special post and pre-treat kits. You guys need to see that on emeragecosmetics.com. Send us a DM, full name, email, phone number. We'll get some of those to you.
Now we're working on his nose just to finish.
Someone's going to need this. Guys, send us a DM.
See, even where I did the nerve blocks, he feels a little bit, so he's just very sensitive, or he metabolizes the nerve blocks very quickly. Doing good.
Is this laser for wrinkles? It can be.
Right.
You do fine lines and wrinkles with this laser. Do you offer radio frequency and CO2 after that? If you're a microneedling radio frequency, we can do that right before we do our CO2.
Turn to the right, or you can do it a month after. With our Aerify kit. Halfway done on the nose. Doing great, more sensitive, but he's a trooper. We're almost done, we're just finishing the nose. You guys see how thorough I'm being? Good. Okay. Good. Okay, just take a quick look. We're gonna do side angle treatment really quickly. So we're gonna hit these scars from a different angle.
Does this laser increase the risk of cancer?
No, this decreases it actually.
The complete opposite.
Let's see, show you this way. There you go, almost there. We're doing angle therapy. Hitting the scars from a
I've
different
got
angle.
skin around my eyes, so they're hollow and you can see veins. Got any treatment for me?
I'm gonna draw
Yes,
down to
there's
the
a treatment.
CO2.
Send us
Okay,
a
keep your eyes
DM. We'd
closed
love to help
for a
you
sec.
out.
Keep them closed. Okay, we're gonna bring this up. That's fine, just leave it there. Now we're gonna put his PRP on. We're gonna microneedle, and then we're gonna apply my mask. So we're gonna do his microneedle. I'm gonna put a lot of hyaluronic acid on right now. Where's the mask?
How does that
Oh,
feel?
it's, okay.
Oh, grab that for me. So she's gonna apply PRP and rub in the hyaluronic. The next step is gonna be take the Emer Skin mask, and you guys could see again, I made this for intense hydration and recovery. So we're gonna microneedle, but I need the juice from this.
Needling the good
I
stuff.
need the juice. This is a very expensive juice right here. So that juice is gonna help him heal. Okay. It's like gin and juice, the Jew and juice. That's me. You got it right here. And that's gonna help him heal. This is our Saturday clinic, guys. All right, so this part you'll feel a little bit, but we're gonna do just a light. Now, for those providers out there, you don't need to be killing people with microneedling after you laser them. The goal is not to damage the skin. The goal is to create microchannels that push these products into the skin, such as the ones that I just put on his skin, and the ones that we are going to be putting on with his PRP. So you see his PRP, we need to get that in the skin. Light bleeding, very light, just micro bleeding. You don't need a lot. This is not a deep microneedle like people talk about. This is to keep all the channels intact and just to lightly get the skin. Now, what I'm going to do in a second is I'm going to up it a little bit.
For those of providers that are asking this combination questions with settings and stuff, send us a DM. We'll get you in for a training.
Exactly.
I'm not going to tell you on here.
So we are going to now stamp. Okay.
What product is that we're using, guys? This is our hyaluronic acid. This
Right.
is our Hyla B.
Hyla B and our Emer Skin. ACNE and our Emer Skin product. Emer Skin Hydration Mask. So again, I push those products into the skin, doing the microneedling.
How much overlapping is allowed for the CO2 and how many passes? We're not telling you
You
that.
gotta come in, guys. You gotta come train. Again.
Hey, everyone, all the other doctors are off
I
on Saturday.
see.
They're all off on
I
Saturday.
see. All right, you guys. So now we did that. So the whole area has microchannels, and we blasted the acne scars a little bit more. So now we're gonna apply our mask, and our mask is biocellulose, licorice root, tea tree, vitamin C, our growth factors that's in our refit face, as well as hyaluronic acid. So a few botanicals in here, but they're non-botanicals that won't cause allergic reactions, and this will help him cool a little bit. So we're gonna get this on, and we're gonna give him cold air, and then we are set. And that is our full CO2 with recovery, CO2 microneedling, PRP, and our new Emer Skin Hydration. If you're a provider, you can contact us and we'll get you these to your office. If you were doing a facial or a lighter laser, you can actually apply my Aerify kit immediately. Cool down, are you okay?
Yep.
You survived. Good.
We survived.
So you survived. We'll do testimonials. We'll follow him over the next few weeks. Bye, guys. Yeah, just let me turn this up, okay?